there's obviously quite a number of states that are essentially either stalling or have said that they're not going to do this for a long time. And the federal government is, at least per the ACA, is supposed to jump in and set up the exchanges if states don't do it on their own. Could you talk a little bit about what that would mean for these states and how it would impact health insurance coverage?
Yeah, I mean, essentially, stepping back for a second, what are the threats to the Affordable Care Act working? At this point, there's really three major threats. The first threat, of course, is the Supreme Court decision, which now looks like it's going to happen in summer 2012. As I said, if you strike down the mandate, this bill becomes a lot less effective. The second threat is the election. I think, the best, if a Republican wins the White House, the best one might hope for is that states just opt out, and the worst is that the entire bill goes down. The third threat, and really the most certain threat, is states not working hard enough to implement this bill. And there's two senses in which states need to work to implement this bill. The first sense is literally setting up a functioning exchange. I'm not super worried, actually, based on the fact states are going slow on that. The truth is, the deadline's pretty far away. I mean, the deadline, they have to have an operating exchange up and running by they have to be enrolling people by October 2013. That's a lifetime away for these politicians. And while it'd be great if they were like California and Colorado and other states that are moving fast in their exchanges, it's not the end of the world that they're not. And the truth is, even if they didn't start till later in 2012, that's still enough time to get it done. So I'm not super panicked about that. What I'm more panicked about is the importance of in creating a new culture of insurance.